is Wolf Kirsten. I am the co-director of the Global Center for Healthy Workplaces and also the immediate past president of the International Association for Worksite Health Promotion. And I'd like to welcome you today for today's webinar titled Healthiest Workplaces Webinar featuring the Spokane Regional Health District case study. Before we get into the meat of our case study here, I'd like to do a few housekeeping calls to kick it off. All participant lines have been placed on mute in order to keep background noise at a minimum. However, we will still be able to take your questions. There are two ways to ask a question. The first way is to raise your hand using the hand icon on the left side of your toolbar. If you select this icon, I will unmute your audio line so that you can ask a question via the phone or your headset. If you plan to ask a question over the phone line, be sure you entered your audio PIN number when you called in, or you may enter that number now. You may also type your question in the question portion of your toolbar, and we will read your question to the group. We will try to answer as many questions as possible prior to the end of the session. Please note that no portion of these slides should be reproduced without the written express consent of the presenter. This event will offer one ACSM continuing education credit. All participants at your site are eligible to receive the CEC. Following this session, you will receive an email with the CEC information as well as a link to a brief survey. Please take just a few moments to complete the survey. Every survey response is reviewed and used to plan future offerings. As a reminder, this event is presented by the IAWHP, International Association for Worksite Health Promotion, which is an ACSM affiliate society, in partnership with the Global Center for Healthy Workplaces. IAWHP is the first global association dedicated to advancing the global community of worksite health promotion practitioners. I encourage you to learn more about IAWHP, its benefits and programs online at www.iawhp.org. Very simple. Or even better, interact with other professionals by becoming a fan of IAWHP on Facebook or joining our LinkedIn group. So before I introduce today's speaker, featured speaker, Tiffany Turner from Spokane Regional Health District, I'd just like to spend a few moments here explaining what the Global Healthy Workplace Awards are all about, especially for those of you who don't know them. As you can see on your screen right now, the Global Healthy Workplace Awards are hosted by iGenius, which is a world community of social entrepreneurs with members in 200 countries based in the UK, and International Health Consulting, which is a company that I lead focusing on workplace health and promotion with specialty on multinational employers. And as you can see in the advisory board, the first one right there is the IAWHP, and the association has been a trusted and valued partner in this awards program, which is now running in its third year, I should mention. You will also see a number of different large or leading organizations here on the advisory board. For example, the umbrella association of all national employer federations, which is called the International Organization of Employers, IOE, very valued partner in terms of spreading out the word about the opportunity to their network. Also, we have the IIHP, the International Institute for Health Promotion from American University, on board, the European Network for Workplace Health Promotion. For those of you in Europe, I'm sure you know them, very active. I've been very active for like over 20 years now. Of course, HERO, the Health Enhancement Research Organization, very known and leading authority here in the United States. People in Aid, focusing on the NGO workers, very interesting programs for the health of the NGO workers, and also the Catholic Medical Mission Board. So I think we have a broad array here of advisors, and they keep us on track and just keep us on track to make it a better program. If we can slide it to the next slide, thank you. So I think a lot of you are maybe familiar with this framework, and I put it up here because first of all, this is the World Health Organization Healthy Workplace Framework, and the awards program is aligned or based on this framework. At this point, I will say that it's not officially endorsed by the WHO, and I have a disclaimer coming up, which I'll show you in a minute. But just so you know, it's closely aligned, but at the same time, the WHO has a policy of not endorsing programs which recognize private employers from the private sector. So I won't go into too much detail here because it could take a while to explain the model, and I think Tiffany will do a good job doing that. However, I'd like to point out that it is a fairly complex or comprehensive model. So you do have, of course, your wellness programs, but at the same time, you have your work environment, both psychosocial and physical, which is not always easy to cover or to address the challenges that you may have there. And then also the enterprise community involvement, so that it's not just about your own workers or your office and it stops there, but also the community at large around you as an employer. And the center circles, I think you'll be very familiar with the continual improvement cycle, very important. Still too many employers do not assess or do not evaluate, can't show their outcomes, and then may not even do a needs assessment. So those for some may be basic things, but for others may be pretty challenging. So just wanted to put that out there that we are very closely aligned with this, and we'll keep doing that. It's universally or globally recognized. It's relevant to large, small, medium-sized employers, any industry. So I think it's really the best model out there to follow. I did have on the left bottom here, I added innovation and replication, which is not in itself described in the framework or model, but that we as awards organizers thought very important that first of all, replication, that other employers, other professionals worldwide can learn from this and possibly replicate. We know we can't replicate everything, and definitely not one-to-one from country to country, but we do want to point that out, that employers show that and make a point to it that other employers can learn from their story, from their success story. And at the same time, we highly value innovation. I think it's an overused word, but at the same time very important to continuously learn about new approaches which work, innovative approaches. So we do score that, or I should say, not we, our judges, because we have 5 different judges from 5 different continents who judge the entrance of the applications, and they look at that. They look at, is there an innovative feature here, and they score it. So I did want to point that out. And if we could go to the next slide, thank you. And that's just I have it up here because I need to. It's a disclaimer from the WHO. Again, they're not officially involved or endorsing this. And then the next slide, please. And here you can see from as I said, we're in our 3rd year, and in May we'll have the awards summit, and the application process starts in January in terms of sending in your applications, the judges doing their work, and till the end of February, and then we'll plan for the actual awards summit in May in Brazil next year. The exciting part is that the winners will not be decided before the summit. So 2 companies, and maybe Tiffany can explain a little bit of her experience in Shanghai this year. The 2 finalists in each category, and there's 3 categories I should mention: small and medium-sized employers, large enterprises, and multinationals. And of those 3, 2 each are invited to come to the summit, and they basically have to present their case study, make a good case, and they will be judged on site, in addition to, of course, their written application. So that's a certain percentage which comes into that. And we had some great presentations this year and also last year, and very motivated. Did a great job presenting their own program. You can really tell they live and breathe this stuff. So, and as you can see here, these are our winners, and I won't go into detail of all of these because today we would really like to focus on Spokane Regional Health District in red, as you can see there, who won the Small and Medium-Sized Employer Award. So first of all, congratulations again, Tiffany, to winning the award. And let me introduce you, and then I'll hand it over to you. Tiffany Turner is a health program specialist in the Disease Prevention and Response Program at the Spokane Regional Health District in Spokane, Washington. She's been employed there for the last 12 years in the Public Health Preparedness Program and works as a liaison between the medical community and the communicable disease program. She's a member of our agency's Living Well Committee that strives to create and maintain a culture of health in their workplace. So we really appreciate Tiffany's willingness to share her knowledge and the case study. So Tiffany, I'll hand it over and take it away, please.
Great. Thank you, Will. So I just want to welcome everyone that's attending the call today, the webinar. It's encouraging to see the interest in worksite wellness, and I know it's a passion of mine and hopefully is of yours as well. So I'm hoping to be able to share a few things about our agency and our program that might help inspire you to move your worksite wellness program forward. So as mentioned, I work at Spokane Regional Health District in Spokane, Washington, which, as you can see from the map there, is the northwest corner of the United States there. So, so we are just a smaller community compared to others, but we have a pretty robust program that we're excited to share with you. So a little bit about our agency. We're a public health agency that serves with a vision of mission for a healthy community for all. We're one of the first health districts to become accredited by the Public Health Accreditation Board and received a perfect score with our review that took place in 2013. We have approximately 200 staff that offer programs, over 20 different programs in our agency to serve our community of about 475,000 people in our county. And some of the services that we provide to our community include community and family services, disease prevention and response, which is where I typically work, or my normal job, environmental public health, vital records. We have an opioid treatment program, health promotion activities, and a data center. And one of the things that our data center does to help with health promotion in our community is we provide them with an annual report called Spokane Counts, and that report contains data on over 61 health indicators for our community's health, and it helps organizations within our community to address issues that affect our population's health. So I'm real proud of that report, and that's available on our website if that's something you're interested in. As an agency, though, our focus remains on the health, safety, and well-being for everyone, including all of our employees, and that's what I'm going to share with you. So why worksite wellness? As you can see from the study here pictured from the Institute of Occupational Environmental Medicine, the study was conducted on the health and productivity, and as you can see, the standard reasons for most United States companies is because of our healthcare costs are rising dramatically, and so one of the biggest motivators for providing worksite wellness is to reduce those personal healthcare costs. As you can see from the graphic, though, that's just a small percentage of the costs associated, and so another big motivator is also that productivity cost, and so we're trying to increase productivity and presenteeism and morale. But for our agency, we have a couple other compelling reasons. One of them is the fact that we are a public health agency. It is what we do. It is what we are going out and preaching to our community is, how to lead healthier and safer lives. And so we really feel like we need to set the example for our community. And we realize that if we don't take care of our own employees, then they're not going to be able to help others in our community lead healthier lives. So it's real important for us that we take care of them first. And in essence, it's really just the right thing to do. We really care about our employees, and as you can see from the quote from our health officer, Dr. Joel McCullough, his quote is, "Truly, the health district's most valuable asset is its employees. They're at the heart of why we make such a tangible commitment to wellness at work." And so it's great to have that support, and we realize, and studies have shown too, that healthier and happier employees equal better outcomes, both internally within our organization and externally for our community. So it's a win-win situation all around to offer wellness in our workplace. So we have a Living Well committee. As you can see, we try and have fun. And this is our Worksite Wellness Committee. This is how we branded ourselves as Living Well Committee. This committee was actually started a number of years ago in our agency and was actually started as more of a morale committee and focusing on trying to improve employee morale. It has since evolved over time to focus on creating a culture of health at our agency, and it's been a very long process, but it's exciting to see the changes that have happened. Our committee meets once a month, and consists of representatives from our agency from all different divisions and all different levels within our agency. So we have a good representation from everyone, from frontline staff to mid-level managers to executive leadership staff. Our committee also aims to work with key stakeholders within our agency, such as human resources. We integrate with our safety committee. We include union representatives on our committee as they're able to, because we have 2 unions that represent our agency staff. And then other key stakeholders, like we work very closely with our county health, their employee wellness program as well. We don't pay any one person to lead this effort. I am one of the many members. You know, we have probably about 12 members on our committee, but one of the many members that feel that we just share in that responsibility, and we each consider ourselves health champions within our agency to move our program forward and to move health forward in our agency. And so we all share in that responsibility. So we all have our regular jobs, and this is just, again, a passion of ours that we feel it's important to also devote some time and energy towards moving wellness forward. We do have a very small budget because we are a public health agency. We're dealing with public funds, so we have to be very good stewards of using those public funds. So we don't have a very big budget. We supplement that budget throughout the year by certain fundraising activities as well to have that budget a little bit more. But we have, I think, a very successful program considering the size of our budget. And a big thing for our committee is constant communication with our staff as well, because we really want to educate them on different health initiatives as well as promoting different activities and events that we have going on throughout our agency. So we have various means of communication within our agency. So our program is based on the World Health Organization worksite wellness model that Wolf had mentioned earlier. We do follow the different components of this model. It's based on this model, and I'm hoping to cover the different components of the model and explain how our agency's program aligns with these different components. The first component being the leadership engagement. So we really feel like leadership is a critical part to our program. And this picture is a picture of our health officer, again, Dr. Joe McCullough, who's a prime model for health in the workplace. He rides his bike to work on a regular basis and participates in all kinds of the health activities and promotion activities going on, as well as the rest of our leadership team. We're really fortunate to have leaders that promote and model health in our agency. The leaders in our agency support staff in their wellness efforts, both time to help plan programs and also to participate in programs that we offer. And again, they support the line item in our budget, a small line item for funding health initiatives within our agency. And they also are committed to supporting health and wellness by including those aspects in our agency strategic plan, and it's part of our mission and our plan. So those are all critical pieces to having that leadership support. The next area that I want to talk about is worker involvement, and we really strive to get input from all of our workers within our agency, and we do that through providing different staff assessments and surveys throughout the year to ensure that we're meeting their needs, that we're not just anticipating what we think are their needs, but we're truly hearing from them. So we have one of our surveys that we conduct is called a health risk assessment, and this is a picture of one of the pages of that health risk assessment. So it's looking at different health indicators such as smoking, nutrition, physical activity, and mental health. So we compile that data. It's all confidential because we don't know who answered it, so that's an important piece of collecting this information for our staff, is that it is kept confidential. The other survey that we conduct is an employee satisfaction survey, and this gathers data on participation and engagement of our employees in the different activities and events that we offer, as well as how satisfied they are with those different programs and activities and support that we provide them. and always encouraging different feedback and ideas from them. A lot of the programs that we've implemented in our agency have been from employee ideas coming forward, so that's been exciting. And then we have other ways that we try and get employee feedback as much as possible and involve them in agency or in wellness planning. We have evaluations of the different programs that we offer, so specific to those activities that we use to evaluate that activity and then improve on it for the next time. We have focus groups within our agency and also develop subcommittees occasionally to address certain health issues, so we pull in additional staff besides our committee members to work on those issues. The next area that I'd like to talk about is a continuous quality improvement cycle. We do follow this cycle as a program, again, using the data that we've collected from the surveys that I mentioned. We also look at different types of other data, such as injury claims, inspection data, and we come up with an annual work plan for our committee to work on, and the annual work plan has specific goals. And our goals really, we try and focus on the policy, systems, and environmental changes, because we know from experience and from best practices that when you're working at policy, systems, and environmental level, you really have a bigger impact on creating behavioral changes within your agency and supporting those changes. So that's where we try and focus our efforts on, is at those different levels. We do some individual programming, but we also try and look at other factors like coworkers and family involvement. We look at processes and procedures within the organization. We look at community and environment, and again, policy issues. So really trying to have a comprehensive approach to wellness. We try and focus on implementing best practice interventions and interventions that are really evidence-based, so we know that they're effective interventions. And then, like was mentioned, we evaluate our programs through surveys and assessments, and then determine if we're reaching our goals and trying to improve those for the next time. And throughout this work plan, we have to really keep in mind some of the other factors that, because we have such a diverse workforce here, as you heard from the services we provide, we have all types of different skill sets and health levels and ability levels from our staff within our agency, and we have also staff that work off-site in other locations within our city, and we have a lot of workers that work in the field the majority of their day, so they're not always in our office, so we have to find different ways to include them in our initiatives. And then we have our workers work various schedules, so some come in early and leave early, some come in later and leave later, some work weekends, some work days, some work nights, so we really have to try and incorporate that. And then, of course, we have different ages and genders within our agency. So all those are considerations that we have to take into account when planning for our staff. Next, I want to talk about the physical work environment piece of the model. And our goal here is that we want to provide a safe and healthy environment for our staff. And one of the ways that we do that is our campus here is a smoke-free campus. They are not allowed to smoke on our campus except in a couple designated areas that are off to the side of our campus, away from people and away from the building. We also have a non-hire smoking policy, so being a non-smoker is a condition of employment here, so they have to attest to that during the hiring process. We also have pictured on the picture to the right is a picture of the standing workstation. These are one of the options that we give employees to help reduce the risk of sitting all day. And we also offer ergonomic assessments to our employees, to where we can go in and evaluate their ergonomic positions and provide them equipment to reduce any type of repetitive injuries. We also follow, of course, all the different safety laws and policies that are in place for our state, and have required safety training such as CPR and first aid, bloodborne pathogen, driver safety and education, and various other trainings that we offer our employees, as well as doing regular safety inspections. So again, the goal here is to provide that supportive environment to encourage healthy behaviors. Next, I want to talk about the personal health resources that we offer. So our goal here is that we try and make the healthy choice the easy choice by providing that different resources for our employees. So one of the resources that we provide is we do have some treadmill workstations as seen to the left here. So these are treadmills and workstations that are set up specifically so you can walk while you're working on your computer or watching a webinar. And then we also offer stability balls that people can sit at in place of their chairs to work on their core while they're doing their work. The picture on the bottom left is a picture of the healthy vending machine that we have here in our agency. And this allows us to have healthier food options. It's located down in our lobby, so it's available to both employees and clients that come into our building. And then we also offer fresh fruits and vegetables every week to our employees at a discounted rate. So those are available as a healthy option as well. And the bottom right corner is a picture of one of the biometric screenings. So we offer free on-site biometric screenings that include things such as blood pressure, cholesterol, body mass index, and blood sugar. And we are able to do this with a very small budget because we have schools of nursing and pharmacy students help us with that. And then we also offer free flu vaccinations to our staff every year, as well as we have a mobile van that comes in to our agency every month or so that offers screening for breast cancer. And then we also have a library of various resources, books, videos, the balls, pedometers, these types of things that employees can check out for their health. And then we also offer free or low-cost physical activity classes and opportunities throughout our agency at different times. We have classes such as yoga and Tai Chi that are available. We have weight and cardio fitness classes, as well as strength training classes. We have walking groups, organized walking groups. We have offer discounted gym memberships. We have 2 gyms that are within walking distance of our agency. We're fortunate in that instance. And then we also have a program where we offer a loaner bike. So we have a bike that employees can check out to ride to meetings in the community during their workday. And then we offer a secure bike room where employees who decide to commute to work on their bike can lock up their bike in a secure area. And then we offer on-site shower facilities after all is said and done, so they can make sure they can clean up before they return back to work. And then, so we're really just trying to provide as many opportunities and choices for employees as we possibly can. We don't want to try and tell them what to do, but just offer them as many choices and provide support for those choices as we can. Next, I want to talk about the psychosocial work environment here at our agency. We strive to create a work-life balance by reducing their stress and helping them balance their work and life responsibilities. So the top picture is we have an infant in the workplace policy, which in the U.S. is important for us. It's a big motivator to recruiting and retaining quality employees, because in the U.S. we only have about 12 weeks of paid maternity leave. And so it's important for us to encourage the continuation of breastfeeding for mothers. And so mothers or fathers can bring their baby to work for up to 3 months to maintain that connection, and then they can keep the baby here at work for up to 6 months if they're breastfeeding. So that's been a real positive benefit that we offer employees. We also offer breastfeeding rooms here at our agency, so they're able to, again, promote breastfeeding, the continuation of breastfeeding, because we know how healthy that is. We also offer telework options, so employees are able to work from home on occasion if they need to, and also flexible work schedules. So if they have other family needs or that they need to take care of, we offer work schedules to where they can flex their work time to accommodate those needs. Personally, one of my favorite benefits, because it allows me to be involved with my daughter's school and sport activities, so I love that benefit. And then we also offer different types of fun social events throughout the year for our agency. We have different divisions that lead different social functions, such as a barbecue or a progressive lunch or a Cinco de Mayo celebration, to where all the employees are able to come together and have that social time to connect with each other. So that's been real popular in our agency. One of the other benefits that we provide to our staff is what's called an employee assistance program, which offers free counseling sessions for employees to go in and discuss work, family, or drug alcohol issues or other financial stressors or anything else, any other issues that they have that they'd like to discuss with a counselor. So we provide those services to them free of charge. And then I want to talk about our community involvement. We do promote health in our community. It is what we do as an agency, as a public health agency. So we also promote it internally by supporting staff participation in different types of community events. We offer different types of walking maps, both to our staff and to our community. We have the benefit of being located right near our river that runs through our city, and so it's just a beautiful walking environment. And so we provide maps that show employees and the public different routes that they can walk of varying lengths. We also offer a farmer's market to our employees where we we support local businesses and farmers by purchasing fruit and vegetable baskets from them and then bring that in and offer those to our employees at a reduced cost. And so that's really supporting our local economy. It's a lot of times it's very fresh and organic produce that's available to them. And then we try to encourage alternative methods of transportation for our employees. So we encourage that through offering free bus passes. Like I mentioned earlier, we have the secure bike room, and then we also offer other incentives and prizes for doing those commute alternatives to reduce that environmental impact. And then we try and promote a green environment in our agency as well by promoting recycling and using reusable dishware. So our program is, again, we work on a very small budget, so it's important to us that we have a program that we can sustain on a small budget, and we do that through using partnerships and policies in our community. So partnerships are key. It allows us to provide our program at a low cost. So on the left there is a picture of one of our credit unions that we work closely with, and the credit unions will come in and provide our staff with financial educational seminars as well as tools and resources available to help them plan their financial wellness. And they also offer us some incentive or monetary donations to provide incentives for some of the programs that we offer as well. On the right here, like I mentioned, we have pharmacy students from our college health programs and nursing students and also health promotion students who come in and work with us to help plan programs and to provide programs such as our biometric screenings free of charge for our staff. So it's a win-win situation for us both. It provides the students with the experience and the training that they need to continue their careers forward, and then allows us to offer these screenings at no service cost. The only cost that we incur from these screenings are for the cartridges that they need to measure some of those biometric. And so that, again, just allows us to offer that opportunity at little cost to us as an agency. And then we also have employees that are very motivated and driven to lead some of these exercise classes that were mentioned, like, you know, if they want a new yoga class or a new exercise class, they coordinate the entire thing, so it's less drain on our committee resources, our committee time. And so they've really taken the charge to lead those activities and coordinate the room availabilities and registration for those. A lot of the classes are free, or employees do a cost share where they're willing to pay a certain amount to make it have it accessible here at work. So that's a benefit to them. And so we just feel like really the key to sustaining, again, these partnerships that we've developed along with putting policies and systems in place in our agency. And we have an employee handbook that outlines a lot of the different policies and systems that we have to promote safety and health within our agency. We also offer a wellness day incentive to our employees. So if they have so many hours or less of sick time, then they are awarded a wellness day every year. So that's an incentive for them as well to stay healthy. And then as far as our program being replicable, we have what we have created a worksite wellness toolkit that we offer businesses within our community. And this toolkit consists of checklists and tools and resources that businesses can use to implement a workplace wellness program within their agency. And we try and provide them guidance to support those programs. It's a very comprehensive approach, just like the WHO model. It's based on the WHO model as well as the Centers for Disease Control wellness model, and it really focuses on practices, best practices and research-based initiatives, as well as, like I mentioned earlier, the policies and systems and environmental changes that we see the biggest impact from. So this is one way that we can help other agencies replicate a wellness program. So as a result of these various interventions in the program that I just explained, we've seen some definite great results over time as we've trended the data that we've collected. We've seen an increase in or improvement in the mental health of our employees, so that's been great to see that result, as well as overall health status has improved in our employees. We've also seen injury claims go down. We've only had 4 injury claims in the last couple of years. We do have the benefit of the fact that most of our employees aren't working with machinery, so we don't have as high injury rates as many agencies do. One of the other improvements that we've seen is we've seen a decrease in the percentage of employees who smoke in our agency. So that's been great because that has a huge effect on health effects and healthcare costs. We also have improved healthier hearts in our employees. We have cut in half the employees that have been treated for heart disease. They've lowered their blood pressure, they've lowered their BMI, and a lot more of them are now at a healthier weight than they were previously. So these are some exciting results that we've seen come out of this program. Through our satisfaction survey, we also have noted that 97% of our employees feel that the agency provides them support through different programs, policies, and environment. So this is great to know that our employees really do feel supported in their health and safety efforts. So because of all this, we were recognized as one of the healthiest workplaces in the world for the small, medium-sized company category at the Global Healthy Workplace Awards in Shanghai, China in April of this year. And I was fortunate to be the one to go and represent all the great work that our agency has done, and it was an amazing experience to go to a different country and experience a different culture, and to see, just to hear all the different companies and the initiatives that they're implementing and the different challenges that they have and their different motivations for creating a worksite wellness program. So I can't say enough about the experience of learning all of that, as well as being in a different country and seeing how China is progressing their worksite wellness programs forward as well. Because of this award, we've received quite a bit of media attention. We've had a couple different TV stations run press releases, as well as radio shows that have talked interviews with us, and we've had newspaper print stories run on our award. So it's been great to have that recognition within our community. We've also had other agencies that have contacted us about our program and offering us congratulations and you know, inquiring about the different aspects of our program, and we're more than willing to share with them to help them build stronger programs within their agencies. And more importantly, this award has really renewed our energy at our health district towards worksite wellness. So we've really seen an increased engagement from staff and leadership towards worksite wellness, and it's really helping us carry that momentum forward to keep improving what we've been working on and move us to that next level. And this award has really validated the great work that our staff have done with our program, and you know, the resources that we need to move forward. So that's been great to have that support there, and is now you know, worksite wellness is part of our newly revised strategic goals, one of our goals. So that's exciting, again, that we have that support and buy-in from our entire agency to move us towards our end goal, which for us is, again, just creating a strong culture of health within our agency. So with that, that's pretty much our program.
Great. Well, Tiffany, thank you so much for a wonderful presentation. Just to remind everybody, as we take questions, there are two ways to ask a question. The first is to raise your hand using the hand icon on the left side of your toolbar. If you select this, we will unmute your audio line so you can ask your question live, or you can just type a question in the question portion of your toolbar. So the first question that we have, Tiffany, is what is the budget that you have for the Living Well Committee?
Our budget, some of you may laugh at it as you're from larger organizations, but our budget is only $2,000 for the year. As I had mentioned, staff time does not go into this budget because everyone volunteers their time as part of additional responsibilities of their job. So the majority of that budget, like I said, we also do a few fundraising things that it might add a few more $100 to our budget if we're lucky. But the majority of that budget goes towards those health screening cartridges, like I had mentioned. And then we do offer at least one individual programming activity every year that we try and provide incentives to participants in that program. And so that money goes towards providing those incentives. And so it's a very small budget, but we try and make it work go as far as we possibly can.
Great. The next question we have, what ideas do you have for engaging remote employees that rarely or don't ever come into your office?
We have, within our agency, we have a SharePoint site, which is, we try and use that site as much as we can to help engage those that are off-site. We also work with those managers of off-site employees to help promote some of the programs that we have and provide communication to those off-site employees as well. The programs that we design, the ones that we design on an individual basis, we try and, like I said, accommodate those that work off-site. So they're programs that they can participate in as well. They don't have to be within our office to participate in those. And then for some of those off-site employees, our agency has also committed to giving them some paid time so they can come and participate in some of the activities that we do offer within our main building.
The next question we have, how long was your wellness program in existence before it yielded all these benefits?
I was trying to remember how long it's been in existence. Like I said, it's really evolved over time, and we honestly didn't start really focusing on the data collection and the culture changes. We were very much into individual programming prior, and before we moved to the environmental and policies and systems piece focus. And so I think I would guess, let's see, I've been here 12 years, and I know it was in existence before that, but I would say it's probably only been in the last 3 to 4 years where we've really had that focus on data and environmental and policy piece. So it's a very slow process to change a culture, but we're just sticking in it and being patient. But it's been very exciting to see changes happen. It's a slow process, but they do happen.
With regard to the WHO Healthy Workplace Framework, which area of the 4 or aspect in the inner circle has provided the toughest challenge for you?
For us as a public health agency, believe it or not, it's been very difficult for us to get our employees to focus on themselves. We're very much externally focused in our health promotion activities and focused on keeping our community healthy, and therefore sometimes neglect to think of ourselves first. And so that's been a challenge for us, is to really have that become a key value within our agency and part of the way we do business, to look internally. So it's that kind of values, that core piece of that model is that values is how we value it as an agency, and making it become what we do both internally and externally.
Do you think a small or medium-sized enterprise are good settings to promote health compared to larger enterprises, or are they at a disadvantage?
I think there's advantages and disadvantages to both. I think as a small company, small or medium-sized company, you have that more personal aspect to your program. You can relate to people one-on-one more, or it's more manageable because you have less locations you're dealing with. You're not dealing with some of the larger geographical challenges of having employees in different states or even different countries or different cultures you're dealing with. So in that respect, it's definitely a benefit to being a smaller size company. But we definitely have challenges of being smaller size. One of them is, of course, being the funding. Especially as a public health agency, we're not privately funded, so we do have to really be good stewards of the funding that we do receive, and we don't have very much of it to go very far, so funding is definitely a challenge. The other thing that, as a small agency, we are not large enough to be self-insured, so we rely, our health program, our health plan is part of our state health plan. We had to join with the state health plan to get the lower rates, and so therefore, as being part of a state plan, we have really no control over our health plan or premiums or providing incentives to our health plan for different health activities that employees participate in. So that kind of works against us in some respects, but we're trying to work around that, and having access to that health data has been very difficult for us. That's why we have our own health assessment that we did, because we can't gather data from our state health system for our employees. And then I think just being a small company, I mean, I suppose it's for both small and large. It's heavy workloads has been a big struggle for us, and I'm assuming that applies to both big and small. But our employees wear very many different hats here because we are a smaller agency, and with obviously businesses going towards doing more with less, that it's again very challenging to have them take time out of their work time to focus on their health. And so I think those have been some of the challenges of being a smaller agency.
The next question is related to what you were just discussing. To what extent has the program impacted your healthcare cost? That's one thing that's very difficult for us to evaluate, again, because we don't have access to a lot of that data or information. There's no way for the state program. We're currently working with the state program to be able to gain more access or try to gain more access to some of that data, but their systems are not set up to differentiate our employees from the rest of the state employees. And so it's very challenging to try and determine how it's affected our healthcare costs. So we just work with the data that we have, and unfortunately that is not one that we have right now to be able to say, yes, this is a direct result of the programs that we have put in place. But we hope that it has affected that, but we can't say for sure that it has. The next question, how many people are in your agency?
We have over, approximately 200 employees, some of those being intermittent, but on average 200 employees.
Okay. You mentioned different types of communication among staff for your programs. Do you find some communication avenues more successful than others?
Yes, we have, we've instituted what we call potty talkers here at our agency, where we have post educational flyers on the back of the restroom stalls in our agency, because we found that this is actually a very effective method because you kind of have a captive audience. And so we're taking advantage of that and offering education during that time, and as well as wherever else we can in our agency. But so that's been, I think, one of the best ways that we've gotten the message out, because we have our SharePoint site, like I'd mentioned, we have emails, but with people's busy work schedules and being off, out in the field a good part of the day, sometimes it's really hard for them to keep up with the emails. And so that's kind of been one of our challenges. But again, I think the key is just having redundant forms of communication. So if we don't get them one way, we're going to get the information to them another.
what are some specific strategies you've adopted to sustain your wellness program?
Like I had mentioned, it's really those partnerships, and it's really the, as we've seen this culture change, the employees have really risen up to take the lead for their own health by again, doing a lot of the work themselves, so it's not such a strain on the few members of our committee to do all the work. That employees have really, you know, if they come to us with an idea, it's like, fantastic, that's a great idea, do you mind taking the lead on that idea? And they will run with it. And that's been so helpful for the sustainment of our program, because again, we're trying to do this job in addition to our normal jobs, and we just don't have time to organize all these different, you know, classes and activities. And so employees, if they feel like that's something that they're interested in and something that they would like to see in our agency, then they will take it and go with it and plan and coordinate that activity themselves. So that's really been one of the key things, is the more employees that we have on board and engaged in wellness, the easier it is for our committee to keep those things going. And we can focus on, again, those policies and environment pieces as they progress, you know, the individual programs forward.
The next question, would you be willing to share your worksite wellness toolkit?
Absolutely. It is on our website, but if you have a difficult time locating it on our website, please email me. My contact information was on that first slide in the presentation, and I would be more than happy to direct you to the place on our website where you can find that toolkit.
All right. What words of advice do you have for small enterprises interested in applying for the global awards?
I would say it's really taking a look at that WHO model and comparing your worksite wellness program to that WHO model and identifying, you know, what areas that you have strengths in and promoting those strengths during the application process. And it also helps you identify some of the areas that you may fall short in, some of the gaps in your programming that you may want to focus on to strengthen your program. So it's really looking at that model and looking at what you do in relation to how it aligns with that model. And really, you know, that model is a very comprehensive model, as Wilfo said, and so that's important to keep in mind when you're talking about wellness. It's not just individual programming; it is about all pieces of that, all components of that model. And so you really have to think about a very comprehensive approach to your wellness and promote that during your application process.
If I may jump in here, Heather and Tiffany. I think you may make a great point there, because you know, in terms of our applications, we still see a number not really following the framework or model and not really addressing it. And I think the clearer you make that connection, the better. And I think it's broad enough so that you can include a lot of activities under these different areas. And I also would suggest taking a little closer look at the actual WHO material, which exists alongside the actual model, because it explains and gives examples. So, for example, if you talk about the psychosocial work environment, you know, a lot of companies just respond with an EAP program. I mean, that's one aspect. EAP programs are important and serve a purpose, but if that's all you have, you know, maybe you should take a closer look. What does it really mean to create a good work environment and a psychosocial aspect? So, you know, I just advise, for those of you really interested, I advise you to take, you know, just take a little closer look at what's behind the model, because I think that really helps with your that
I would totally agree with that. We did read through the WHO additional materials provided, that supplement the model, and that's definitely helped us identify what things we include in the different components during our application process.
Excellent. And if I may say, well, first of all, thank you for the presentation. I think you outlined it very clearly, and also for your willingness to share the toolkit. That's great, because that, again, that aligns very nicely with kind of the replication aspect of it, that others can learn from it. So that's wonderful. So that's really good. I had one question which I thought was really interesting, and I didn't think I heard it before, Tiffany. That you said you originally started the the committee, the Living Well Committee, because employee morale was low, or there was some issues around that. Can you explain that, and I think you mentioned with one of your outcomes that the satisfaction at least is very good. So you feel you're on the way of accomplishing that objective, or how does it go?
Yeah, absolutely. Morale is difficult in a public health agency because funding is a big issue for staff, and job security is a big issue for our staff. So we have to be cognizant of that as an agency and as a committee, that we're addressing those employees' concerns. And that's why morale can sometimes, depending on the state budget or the federal budgets, as we get cuts, it affects our employees on a personal level because they may not feel as secure. And so different ways that we can address those stressors in their work life, and keeping them healthy to deal with those stress is important to us and important to them. And so, again, that's kind of where it all started, was because of some of those major budget cuts that have happened in our agency over the years, that we did have some low morale, and so we started off with some of those social events to really get people together and have some exciting and happy events going on within our agency. But again, we also realize that health is a huge component of employee wellness, and so we started focusing on more of the health issues, and as well as still incorporating those social aspects to health and wellness.
Yeah, that's great. It's a good example of a proactive strategy and looking forward. As a lot of employers unfortunately do not do. And I think most of you will know that, at least if you're familiar with the global survey from Buck Consultants, that employee morale and stress, which are obviously closely linked, are the number one, one of the top drivers, in terms of the health issues affecting employers globally. And and I think everybody, or most people you'll talk with, will probably agree with that. It doesn't matter where you are. If you're in the U.S., in Germany, in South Africa, or in China, that's huge. And so it's really important to focus on that. So it's a great example of doing so. So appreciate that. I don't know, Heather, if we have any other questions. I know we're getting close to the top of the hour. I do want to point out that we have 2 more webinars coming up aligned with the Global Awards. One is the large enterprise, which Telefonica in Brazil won, and then the multinationals, which IBM won the award. And so you will see some common elements, some similarities, but you will also see a lot of differences, as Tiffany indicated. Doing it multinationally or globally is another whole set of challenges. But I think this is a good time to, again, thank you, Tiffany, for presenting and taking the time and sharing it with the world, so to say. I think it's very much our mission, and hopefully we can continue to do that and feature many good other case studies. So Heather, I don't know if you have any closing words, but I would like to thank the participants also for taking the time, whatever time of the day it is for you. So Heather, I'll hand it back to you.
Great. Well, at this point, then, that does conclude today's webinar. Again, thanks to Tiffany and Wolf for putting this on. Please watch your email for the survey and the continuing education information that will be sent to you later today, and also watch your email for future IAWHP webinar and other events. We hope you enjoy the rest of the day wherever you are. Thank you.
Thank you.